going to start the webinar in a minute. We're just going to wait for a couple of more participants to join us. So just 2 more minutes and then we're going to start. Welcome to everyone. If you have any questions about the webinar, please just type in the questions into the record box and I'm going to answer all the questions after the webinar. So we already have a couple of participants. We're just going to give another minute and then we're going to start. Let me share the screen with you so you can see all the presentations. I'm just going to try to do that. I don't know why it doesn't want to share the screen, but we're going to have it fixed immediately. Doesn't want to cooperate today. If you let me know if you can see the screen, that would be wonderful. If not, we're going to have it fixed. I think you should be able to see the screen. If you could just let me know if you can see the screen, that would be absolutely wonderful. In the chat box, you should be able to see BioRePeel screen presentation. Yes, if you could allow me. There's not. Could you please let me know if you can see the screen? You should be able to see presentation. Oh, wonderful. Brilliant. Thank you very much. Wonderful. Yes, wonderful. Thank you so much. Thank you. I just got your messages. I didn't want to start the presentation without you being able to see the screen and just follow it. Okay. Welcome to today's BioRePeel webinar. I will try to answer all your questions. If you have any questions prepared or if you have any questions during the presentation, please just type up your questions in the chat box. I'm going to be checking the chat every couple of minutes and hopefully I'm going to be able to answer your questions during the presentation. If not, I'll definitely answer them after the webinar. So any questions you might have, just type them in. BioRePeelCl3 basic technology. So first of all, let me introduce people responsible for this wonderful product, people who created this product. This is Andrea Marvetti. He has a degree in pharmaceutical science and technology in Department of Pharmacy, University of Pisa. He also has master in marketing and management of the pharmaceutical industry. And this person, you probably know him from the different forums. He's very active, Carlo Michelini. He's always helping with your answers. He's providing all the answers to the questions you might have about the products as well. He has a degree in pharmaceutical chemistry and technologies, also at the Department of Pharmacy, University in Pisa, and the production manager, RD management and consultant. Formulation and synthesis experience in the field of medical devices and cosmetics. So those two are responsible for our success, for your success in the salons, and for creation of this wonderful product. First of all, if it comes to contraindications, pregnancy, breastfeeding, of course, post-cancer patients, we have to wait 3 to 5 years, 3 to 5 years after the treatment has completely finished. So whether it was radiotherapy or it was a different treatment, we count this time from the completion of the treatment, from the cancer clear. And we need a letter from the doctor, a letter from the person who's guiding to allow for the treatment. If it was the skin cancer, we always require a letter. We always require a letter, even if it was 10 or 15 years ago. Also, all the autoimmune disorders, and I had a couple of questions. I have a list of autoimmune disorders. If you would like me to email you the list, please send me a message via Facebook or to my email address. I'm going to provide my email address later on. And I'm going to email you all the autoimmune disorders, and there's quite a lot. Sometimes patients don't know that they have autoimmune disorder. Very often we have patients, we have clients with Hashimoto, which is thyroid disease. They don't consider it as autoimmune disorder. With autoimmune disorder, the treatment with the pill itself wouldn't be contraindication, but it could be if you would like to combine it with microneedling or mesotherapy. Why? Because there's always inflammatory state in the body when autoimmune disorder is present, and by doing microneedling or mesotherapy, we're inducing another inflammation. It's controlled inflammation, but our brain doesn't know that. So all the substances, are going to be sent to the largest inflammatory state, the largest inflammatory source, which can lead to complications in the healing process. For our skin, what we need to do, we need to induce inflammation, and then inflammation needs to be stopped immediately. We don't need prolonged inflammation. Prolonged inflammation is not beneficiary for our skin, it's not beneficiary for the procedure. That's why we're avoiding treatment, harsh treatments with the patients with autoimmune disorders. If it comes to the product, I got it with me today. The last webinar I didn't have, unfortunately, I forgot to take it. It's very safe. First of all, it's a very, very safe product. Medical device, but very safe product. You don't need any needles to perform the product and for the treatment to be effective. It's a pain-free, biphasic technology, patented technology, which is very important. We received a patent this year. Multi-action, so it's going to work on many different levels in the skin, not only superficially, it's also going to work in the epidermis, it's going to stimulate collagen and elastin production. Multi-action, immediate effect, and long-term effect. With a long-term effect, of course, the improvement is visible. The improvement is noticeable almost straight away. But if it comes to long-term effect, we've got the collagen production, we've got the elastin production, but we need to remember to remind the patients that if they want to keep the good skin, which we achieved with the help of the BioRePeel, they need to maintain it. So they need to come back at least once a month for a maintenance. They need to come back to the clinic. Unfortunately, there's no such product which would completely stop aging process, so it's something they will have to be doing all the time if they want to keep their good skin. And I have patients asking me, so how long do I have to do it for? For the rest of your lives, if you want to have a good skin. Product is appropriate for all phototypes, Fitzpatrick 1 to 6, for the whole body and for the whole year. So all seasons. It's not photosensitizing, so we can use it all year around. Of course, we might have to adjust how we're using it. So maybe we're not going to be using it with deep microneedling during the summer, because that can induce inflammation, larger inflammation, which can lead to pigmentation when in combination with the sun. But we can use the product all year around. There's many procedures, there's many ways of using the product. You can use it for many different skin conditions, which I'm going to be talking about in a minute. So, two phases, lipolytic and hydrophilic phase. Lipolytic phase, I think I was just playing too much with it. I don't know if you can see. It's the phase which floats on the top. It's the dark green phase. It's protective antioxidant action, moisturizing action, firming action, and it also carries all the active ingredients deep inside the skin. And hydrophilic phase, TCA, AHA, BHA, PHA acids, so all the different groups of acids, amino acids, GABA, and vitamins. So very rich in ingredients. Monophasic phase, monophasic TCA, I'm sorry. The product in TCA, if it's monophasic, it's not very stable. So it's unstable, it's darkening, you have to preserve it in the fridge. It oxidizes, it denaturizes. But in the biphasic technology, in the new biphasic technology, lipolytic phase, which floats on top of the hydrophilic phase, protects it from the oxygen in the bottle. So it stabilizes the hydrophilic phase, and then TCA does not oxidize. It's in its stable form, it doesn't darken. You don't have to preserve it in the fridge. So between 5 and 25 degrees is absolutely safe. So stable in room temperature, no TCA oxidization, no formulation darkening or degradation, and functionalized lipolytic phase. BioRePeel lipo. So bio, you've got all those active ingredients such as amino acids, vitamins, glycine, proline, hydroxyproline. I'm going to be talking about them in a minute a little bit more. GABA, arginine, TCA, lactobionic, salicylic, tartaric, and citric acid, squalane, and isopropyl mystrate. I don't know what products you're using in your clinics. For me, amino acids, which are included in BioRePeelCl3, are very important. As you know, amino acids are the basic building blocks of every single cell. Glycine is the most abundant amino acid in collagen. It has moisturizing, it's antioxidant, regenerating properties, 35% of its presence in the collagen, so huge amount. Proline and hydroxyproline, again, widely present in collagen, increases and supports ceramide synthesis, activating keratinocytes, proliferation, and fibroblast collagen production. Vitamin C, of course, it's not an amino acid, but a vitamin group, but it's an essential cofactor in collagen synthesis. Of course, it's very important agent if it comes to protection from the reactive oxygen species. So very strong antioxidant. Vitamin C, as you know, is quite difficult to stabilize because it oxidizes very quickly, but it's stabilized, it's joined with glucose, so it's able to get deep inside the skin where there it transforms into a clear form of vitamin C. Gamma-arbutin acid, popular GABA. Amino acids, which is chief inhibitory neurotransmitter in the mammalian central nervous system. What it means for us? For us, it means the wow effect for the customers, the wow effect for the clients, first of all. All those superficial lines, wrinkles from the eyes, from the mouth, they're going to be diminished. It also promotes collagen synthesis thanks to inhibition of the cutaneous melanoproteinase, which are protein degradation enzymes. So all this wow effect, it's GABA, it sort of blows up the cells a little bit. So it's relaxing the tissue. So you're going to have this nice soothing effect, smoothing effect of the lines and wrinkles, superficial lines and wrinkles. I'm not talking about the static wrinkles. Static wrinkles are the wrinkles which are visible even if there's no any movement on the face. So those wrinkles are very difficult to get rid of, sometimes impossible, even with therapies as botulinum toxin therapy. There are ways, but we would have to work really aggressively to sort of not get rid of static wrinkles completely, but maybe make them less deep. Arginine is my favorite amino acid. It's used in medicine for all those patients with high blood pressure, with heart problems. It takes part in the blood flow regulation processes. For us, it's going to be really useful if it comes to skins such as rosacea skins, such as treatment of different scars. If you would look on the scar under thermoactive camera, what you're going to notice is going to be bluish or greenish color. It's due to the fact that it has very little capillaries inside. It has very little oxygen delivered to the tissue. It's like a half dead tissue. So that's why we're inducing the damage to the scars or to the stretch marks, because stretch marks are also scars, different types. They're not as deep, but also a scarring. We're inducing the damage because we want to create, we're going to induce the process of angiogenesis, and arginine is really helping and promoting angiogenesis. That's why we have such great effects with the scars treatment with BioRePeelCl3. And that's not the only agent. I'm also going to be talking about the TCA, but arginine is very, very important. Arginine, you're also going to be using not only arginine, the product BioRePeel, with all those skins with rosacea, sensitized skins. Arginine is going to strengthen the blood vessels, the walls of the blood vessels. It's going to be regulating all the biochemical processes like protein synthesis and collagen, elastin, and keratin. So very good indication also for those inelastic skins. Vitamin B2, very important precursor in activation of other vitamins. Very good for those oily skins, for those greasy skins. The lack of vitamin B2 very often leads to the oilness of the skin. So what I do in the clinic, when I have especially mature patients, because I'm not talking about the teenagers as there's always problems with hormonal imbalance, but with mature patients, very often vitamin B or vitamin B group internal intake is going to help you with the whole procedure, with the whole treatment of such patients. When you have patients with greasy, oily skins, because that's very often the question which I get, which product to use post-care, BioRelift or BioRehydra? Then I'm going to use BioRehydra. It's in very jelly formula, so I'm talking about this one. It's very light. You use just a little bit of the product. If you use too much of the product, it's going to create like a mask on your face. So use very little of the product. We also have vitamin B2, which is going to help with the oil production in the skin. And finally, acids, trichloric acid, popular TCA. It's been on the market for years now, but as you know, in its unbuffered form, it was very aggressive. You would need a couple of days, up to 7 days at home of the regeneration process. So very long time, and not many patients were willing to take such a long time off work or dedicate their holidays just to improve the skin. Level of penetration, as you know, depends on the substance concentration. But it's not its exfoliating action which is the most important for me. It's the activation of the biochemical cascade, so activation of the pre-inflammatory response to the chemical acid stress, then activation to the skin stress response system, and the most important, growth factor production in response to this chemical stress. So you've got vascular growth production, again, remember about those rosacea skins, about scarring. You've got palate-driven growth factor, stimulates tissue fibroblast and enhances wound closure by stimulating revitalization. TGF-alpha and beta-1, again produced by fibroblasts and keratinocytes. So cellular proliferation and differentiation. So you've got a lot of different skin types which you can use this product for. And because TCA is buffered with arginine, you're not going to have long recovery period. Most of the cases you don't have any recovery period at all. If you're going to be doing BioRePeelCl3 or BioRePeel body in combination with microneedling, of course, then you can get frosting, that you might get frosting. You do not remove it. You just leave it on the skin for 3 minutes and then you just remove it with water. Another type of skin where you can get frosting, it's these are dehydrated skins. With dehydrated skins, there's always a little bit of a problem because it's either you can't get inflammation at all when you combine it with microneedling, or inflammation is prolonged. So with the dehydrated skins, I never start with a protocol with microneedling on the first visit. I would start it on the third, fourth visit, but not on the first visit. And then recommendation of BioRelift, which is very moisturizing. So we need to prepare the skin, and then we can introduce deeper treatments for the skin. The next acid which is present in the BioRePeelCl3, it's lactobionic acid. Very hydrating, anti-aging molecule. Excuse me. And then, sorry, again, it reduces melanoproteinase production, so very beneficial for those skins with chronoaging and photoaging. Salicylic acid, I think everyone knows this one as the best acid for all those acne, oily skins. It's a beta hydroxide, sorry, very powerful keratolytic. It's penetrate through the, because AHA acids are water soluble, BHA acids are fat soluble. So BHA acid is able to penetrate through all this fat which we have in our skin. It's cleansing all those pores. It's removing all those debris from the skin. So you can notice after the treatment then the skin looks slightly worse than before. And that's what you can say to your patients. If they've got lots of congestion in the skin, salicylic acid is going to clear the skin. It's going to remove all this oil. It's going to remove all this congestion in the skin. So it's something normal. It's something they can expect. And it's actually a good effect for the skin. Salicylic acid is also bacteriostatic, so it's going to prevent from bacteria growth and will reduce, of course, the possibility of formation of acne lesions. Next to tartaric and citric acid, both powerful antioxidants, lightening properties, exfoliating. Tartaric acid is very good if it comes to reducing keratinocytes adhesion. So it will allow for the deeper penetration of active ingredients in the skin. It's very good to treat dry, inelastic skin, acne, blackheads. Citric acid, apart from its antioxidant actions, lightening, exfoliating action, it's also calcium chelator. What it means is going to bind to calcium ions, it's going to sort of pull them apart and create leeway for the active ingredients through which they can go to the skin. So 1 concept, 2 phases, 4 functional complexes, and 9 actions, which I just explained to you. Lipolytic phase and hydrophilic phase. So the lipolytic phase, you've got, you can't see it, but it's this dark blue one. Protective and stabilizing action, affirming, regenerating action, very moisturizing for the skin, biostimulating action, revitalizing action. You also got all those peels, so you've got peeling, but you also have activation of the growth factors, activation of the vascular growth factors, so important for the rosacea skin, so important for all those scars treatments. For me, it's the product which replaced all other peels. I don't use any other peels in the practice. Most of my salons which I work with, which I train, also use just one peel, because as you see, that's why it's so important, I think so important to attend the webinar, because if you know all the ingredients, what each ingredient is responsible for, then you can understand that the product is really appropriate for all skin types, for most of the skin conditions. And it's very easy to use. It's really easy to use. Do you have any questions about the product so far? If you don't, I'm going to continue. If you do, please just type them up in the chat box and I'm going to try to answer just after the webinar. Okay, so let's continue. If it comes to, why does it want to move? Okay, so 2 products. FNZ, 35% of TCA, and body, 50% of TCA. I'm going to be talking about the combination of those 2 products. If you combine them in the 50-50 solution, then you're going to obtain 42% of TCA, which is going to have its use in treatment of the melasma, in treatment of the pigmentation, deeper scarring, I will send you all the protocols if you provide your email address, and I'm going to try to explain today how to use them, for different skin conditions. If you have a specific skin condition which you are interested in, if you would like me to tell you about a procedure, what procedure would be suitable, please just write it in the chat box. It's not working. Come on, doesn't want to. Okay, so how much we're using? We use 2 milliliters of the product on the face of the FNZ, 1 to 1.5 milliliter on the neck, and 2 to 2.5 milliliter on the décolleté. So that's how much we use. If it comes to the protocol, we use, if you used just the peel without microneedling, without mesotherapy, you're going to use it every 7 days. So you have 4 to 6 treatments once a week. If you're combining it with microneedling, I would recommend 10 to 14 days, depending on the skin. If it's a dehydrated skin, it's going to be at least 14 days because of the regeneration period, because of the inflammatory process, which takes longer to subside in the skin. If it comes to the body, to the protocol, when can we recall it? We can recall it after 3 months. So again, after 3 months, we can do a couple of treatments. We can, just let me see, because I've got some. Let me check. I'm sorry, I'm just going to check because some people can't get into the webinar. Okay, I'm really sorry. See, quite a few people couldn't get to the webinar, but I'm going to record it, or we're just going to repeat it. If it comes to the recall protocol, it's 3 months, but really I do it once a month for my customers, and I just don't stop. So once a month, all the time. And if I see there is a change in the skin condition is getting worse, then of course I'm going to repeat the whole protocol. So one session a week, at least after 3 months. And body, 3 bottles, 12 milliliters each, pH, BHA, tartaric citric acid, amino acids, vitamins, and lifting principle GABA, and also lipolytic phase squalene and isopropyl mesrate. 2 milliliters on hands, so 1 milliliter on each elbow, 5 milliliters if you're going to be treating stomach or gluteus area, 1 milliliter on each knee, and 1.5 milliliter on each foot. And body protocol, you repeat after 10 to 15 days, depending also if you're combining it with microneedling or not. After 3 months, you can repeat the body protocol, or just to keep the good results you have achieved, you can do it once a month. What's very important, as you know, it's a biphasic technology, so 2 phases, lipolytic and hydrophilic. It's very important to really mix it well together. So you're mixing it very well together until you get sort of one color substance. So you don't have any bits of lipolytic phase floating around. So really spend a bit of time on mixing it well together. When you draw it to the syringe, and if you leave it to wait for a couple of minutes while you, for example, preparing the skin, it can, again, sort of set apart. So you need to check in the syringe. You might have to mix it in the syringe again. That's very important. So after you prepare the product, then you draw in 2 milliliters. And I'm going to talk about the protocol in a second. So no needles, no frost, apart from when you're treating, for example, skin with microneedling with 42% or with body product. Immediate results, no oxidization. You don't have to preserve it in the fridge for the whole body, for all ages, and for every season. If you would like to combine it with injectable treatments, you do it before. You do BioRePeel before injectables. before photostimulation, after radiofrequency, and before topical treatments. If it comes to the protocol, you need to cleanse the skin. What you use to cleanse the skin, it's totally up to you. I just use a simple cleanser. I don't use any toners. I just use a milk or remove it with water or as SRV cleanser. And then you need to degrease it. That's the most important step. You really need to degrease the skin properly to remove all remaining of the any cleanser of the oil from the skin. Otherwise, you're not going to have even penetration of the product into the skin, and you're not going to have good results. What I'm using alcohol wipe as a skin degreaser. After you degrease the skin, and please don't forget about this step, it's really, really important. So even when you're rubbing the skin, don't be too gentle. Really, you can be quite rough with the skin until you get a little bit of redness, until you get a little bit of erythema. Remove this oil from the skin. Then again, shake the ampoule really well, prepare the ampoule, draw 2 milliliters of the product. You're just removing this little circle from the inside. Don't remove the whole protective cup. And then you're taking it with 18 or 16G needle. Don't use thinner ones because it's going to be very difficult to draw the product. So you mix the product, you draw 2 milliliters if it comes to the face treatment. You apply it on the degreased skin. Many of you asking about how many layers. We don't apply it with layers, we're just applying 2 milliliters and massaging it onto the skin. So once you massaged it in the nitrile gloves, it doesn't have to be, again, only natural gloves. They are most resistant to the acid. So in my opinion, they are the best, but if you can use different ones. So you massage in the product really well into the skin until it's absorbed, until your glove is really sticky to the skin. And after that, you wait for 3 to 5 minutes. Most of the time, I wait for 5 minutes. Again, questions, can you wait a little bit longer? I wouldn't wait a little bit longer on the first visit, but yes, if the skin is quite thick, if the skin is well moisturized, you can keep it a little bit longer. Nothing is going to happen. Always observe the skin, never leave the patient with the product on the face. Doesn't matter whether it's this product or any other product, just don't, under no circumstance. So after you waited for 5 minutes, you don't neutralize it. TCA, salicylic are self-neutralizing acids. You don't neutralize it. You simply remove it with gauze soaked with water. I always use cold water. So you remove it and you apply BioReHydra for greasy skins, oily skins, or BioRelief. They come in 2 sizes, salon size and retail. You apply it for all those aging, dehydrated skins. And then you make another appointment. It's very important to, I don't know how you're going to be selling the treatment, whether you're going to be selling it in the treatment of 6 or you're going to be selling them as single treatment, but it's very important for the patients, for the clients, to use appropriate home care. It's 50% of your results, what they're using at home. It's also the peace of your mind. You're not going to have any complications. There's so many products available on the market now, and customers have access to many things. You can get anything on the Amazon, basically anything. And it's very important for you to check on the first visit when they come. What I do, I ask them to bring all the products with them. So what they have, what they use as a cleanser, what they use if they use a toner, what they use as a moisturizer. Very often you're going to find ingredients which might cause cross-reaction, which might cause complications. And then the patient is not going to think that it was the product which they used at home caused reaction because it was too much for the skin, it was aggravating the skin. It's going to be you who performed the treatment. So it's in your interest, in patient interest, to make sure that they're using appropriate products at home. So BioReHydra or BioRelief. I've got customers, or even myself, I just use BioReHydra as the serum and BioRelief as the moisturizer. So this is how I use it. And you can use it 2-3 times a day, up to you. But it's very important. It's going to really save you any complications. And we make another appointment in 7 days' time. So depending what treatments you're doing, what kind of skin you're treating, if it's just to improve the density of the skin, if it's to improve how the skin looks, the freshness of the skin, hydration of the skin, you don't need to combine it with any other treatment. And again, I have questions because it takes around 20 minutes, 15-20 minutes for the procedure, and it's quite expensive. What else can you do? You can apply mask, like a sterile mask post-treatment. Just also make sure that it doesn't have any active ingredients. AHAs, BHA acids, retinols, retinoids, it cannot include those ones. You can add LED lamp, depending also on the skin condition. If it's acne, it's going to be blue light, 430 wavelength. If it's going to have stimulating action, it's going to be red or near infrared light. And then the best length waves are between 610 and 830 from what I remember. So you can combine many different procedures. I have to go back. Now, the protocol with microneedling, it's quite similar. Again, I wouldn't use microneedling on the first visit. I know lots of you have clients who do want to see some peeling effect if they're not peeling. I'm really sorry. Yes? Sorry. Okay, guys. So if it comes to more peeling effect, if they want to feel a little bit more, you can combine it with microneedling. You're also going to be combining treatment with microneedling, treating melasma. And melasma protocol I'm going to talk about in a minute. Let's write it down, not to forget. So not for dehydrated skins, not straight away. If someone comes to you with dehydrated skin, and remember that oily skin could be dehydrated as well. It doesn't mean that if it's oily, it's well moisturized. So in the case of the microneedling, you would cleanse the skin, you would degrease the skin again, you would take 2 milliliters of the product, you put 1 milliliter on the face, you massage it in. On top of that, you do microneedling. I only do stamp methods. I don't work very deep. I work between 0.25 and 0.50. I only work deeper if it comes to scar tissue. And then I'm not using dermapen, I'm using micropuncture, which is a different method. And on this microneedled skin, and apply immediately second layer of BioRePeel, massage it in, and from the moment when it's massaged into the skin, then I'm waiting for 5 minutes, 3 to 5 minutes. The patient or the client can feel a little bit more stinging action. There could be a little bit of frosting, could be pinpoint frosting, or just the area, usually around the mouth or nose. Nothing's happening, don't panic, just leave it on the skin, remove it after 3 to 5 minutes. There might be a little bit more peeling in those points. It doesn't do anything negative to the skin. They're just going to enjoy beautiful skin after slightly longer period of recovery. And again, after microneedling, I'm applying BioRehydra or BioRelift. I prefer BioRelift after microneedling because it's more soothing. It stops inflammation very quickly. That's what we need for the skin. It's very moisturizing for the skin as well. Some questions I'm getting about microneedling. Do I use any lidocaine cream? Do I use any local anesthetic? No, I never use local anesthetic with any microneedling at all, because that's it doesn't make any sense. With microneedling, you inducing injury to the skin, and the cells send the signal to the brain immediately that there is something happening, there is a damage to the skin. Once the signal is sent, all the repair process starts, so the histamine is released, etc., etc., etc. With lidocaine, first of all, lidocaine you need to remove really, really carefully from the skin, so there can't be any traces of lidocaine, because lidocaine on the skin after, sometimes it's toxic, it's not good for our skin. The second thing, you're delaying all the process. And there's no point of delaying all the process, because then it's not running as it should be. You get always, from so many years I've been doing microneedling, you never get the same wonderful effects if you use lidocaine versus if you don't use lidocaine. So if you have patients who really can't stand microneedling, then of course you might not have a choice, but use really superficial depth, 0.25 on the skin. It's really enough for all the stimulation, for the inducing of inflammation. You don't need to work very deeply, and then they can stand it. You know, if you're using stamps, it's also less painful than if you just dragging it through the skin and inducing more damage. For the melasma, I didn't write it down here. I'm going to send you melasma protocol if you need one. For the melasma treatment, I'm using two methods. First one, it's cleanse the skin, degrease the skin. If it's a really deep melasma, I check always under the Woods lamp or under observe how deep melasma is. If it's a superficial one, I'm going to use 42%. If it's a deep melasma, I can use 50% body on the face, but only on the melasma. I wouldn't do it on the whole face. So what I do, I will combine microneedling protocol, and then I'm going to first layer, I'm going to apply BioRePeel FNZ on the whole face. I'm going to microneedle it, and only on melasma, I'm going to apply, if it's a deep melasma, body product, and on the rest of the face, again, FNZ. Or what you can do, you can dry microneedle the face, the whole face, and then you apply only on melasma, either 42% or 50%, and on the rest of the face, FND. You need to remember that you always have to treat the whole face. If you treat only the spot where melasma is, the dendrites, which are parts of melanocytes, are going to move, and the pigment is going to be released just in a different place. So you're not going to have great effects. Of course, sun protection, it's very vital. You need to apply sun protection every 2 hours. There's going to be frosting, there's going to be peeling effect if you apply body, or 42% on melasma, but that's something what we want. You can also, other uses for BioRePeel FND, you can safely apply it on the eyelid, very close underneath the eye. Wonderful result. You're not going to cause any harm. That's one of not many products on the market, I think one of two, which you can apply on the eyelid. You can also use FND for the intimate zone renormalization, also a very good protocol. Again, please send your email addresses, and I'll be more than happy to send you all the protocols if you still don't have them. I'm just thinking about any other uses. Combination with mesotherapy, again, you use BioRePeel, and after that, straight away on the same visit, mesotherapy. You can combine it with Botox, you can combine it with fillers. Again, you always do BioRePeel first, and then you do injectables. And now, very quickly, I'm going to tell you about the products which I asked you to use. Let me see there. And again, I'm going to need a little bit of your help. Can you please tell me if you can see by your relieved screen? That would be wonderful if you could help me here, because I need to make sure that you can see the BioRelieved screen. So I'm just going to wait for you to confirm, and then I'm going to tell you about BioRelieved and BioRehydra, and why is it so important, and what are the ingredients which make those products so irreplaceable. So if you can just tell me yes or no if you can see BioRelieved presentation, that would be absolutely brilliant. Can I go through dermaplaning and microdermabrasion protocol, please? I don't combine it with microdermabrasion. The microdermabrasion I stopped using years ago. So I don't have protocol for microdermabrasion. If you're using it in your salon, if you want to use it, if you see good effects, then I would do very superficial microdermabrasion, I'm sorry, and then I would apply BioRePeel, only then. With dermaplanting, again, you do dermaplanting first and then you apply BioRePeel FND only. You wouldn't use BioRePeel body on the face combined with any of those procedures, as you could cause lots of damage to the skin. I've seen really good results with dermaplanting, but again, you would use BioRePeelCl3 only. You wouldn't combine it with any other procedure. And then you just keep it on the skin for 3 to 5 minutes. You remove it with water and you apply BioRePeel. If you can see the presentation, thank you very much, Kathy. I'm going to tell you very quickly about the BioRelift and BioRehydra. Question and answer. Can you advise about maintenance peels through the year? I don't know what peels you're using during in your clinics. As I said, I can tell you about the ingredients which I like. I wouldn't like to comment or recommend any other peels because the only peel I'm using it's BioRePeelCl3. But if you have questions about different peels, I'll be happy to tell you whether you can combine it in between the treatments or not. But I don't see really any point because you've got everything you might need for your customers in one bottle. So if you've got greasy skins, you've got tartaric, you've got citric, you've got salicylic acid. If you've got aging skins, you've got lactobionic, again, tartaric, TCA, arginine, all the amino acids. Remember that amino acids, we produce only 10 amino acids. Our body needs around 29, 30 amino acids. You need to deliver amino acids to the skin to make sure that the skin is plump, to make sure that the skin has enough collagen, enough elastin. So that's going to be very important. Okay, if you see the BioRelift, sorry, it's wonderful. Let me tell you very quickly about the BioRelift. So why we should be using it. Post-treatment cream, and we've got it in 2 sizes. So that's salon size, 200 milliliters, and retail size for your customers. Post-treatment cream, very light, quickly absorbed emulsion. Very silky. I love using it all the time. It's like I'm addicted to it. I don't wear makeup. Maybe that's why I'm a bit shiny, I just noticed. But I use it during the day around eye area, lips. Wonderful if it comes to those little lines and wrinkles because it has over 20 active ingredients. 4 biomimetic peptides enhanced by colloidal platinum, micronized hyaluronic acid, the smallest molecule on the market. Amino acids, vitamins, and lipolytic phase of natural origin. I'm just checking epidermal peels, how long before each one. I just have one question. Can I advise about carrying out this peel and using epidermal peels? So you would like to combine it with other peels? How long before each one? If you're using any other, it really depends on the peel. You need to give me the ingredients because then I can advise you. You need to give me the pH of the peels you're using. You need to give me the active substance, what kind of acid it is, and then I can tell you how long between the treatments, how you can use those treatments in your salon. Because without such information, I cannot give you accurate advice. Okay, 4 biomimetic peptides, dipeptide dimanotrubal, sorry, benzamide, a small peptide that mimics the activity of the poison of a viper. So you've got blocking the receptors present by acetylcholine muscle cells, so it inhibits constructions in the muscle. So you've got immediate Botox-like effect. And then copper palmitols, hexapeptide 14 and hectapeptide 15, palmitates. So synergy of 2 peptides released in the single bond, they bond with copper. So the copper peptide in the special delivery capsule, which means that it takes all the active ingredients deep into the dermis, and once released, it's going to target the matrix protein, elastin, protoglycans, lamin, collagen, elastin. This one is very important peptide. It's a peptide with modulating actions. it's also creating 3D structure for the collagen. So the collagen, not only we increase the collagen production, but we also build the structure like a scaffold for the collagen. Colloidal platinum maintains the electrical balance in the epidermis. As you know, every single cell has its electrical balance. So maintaining the electrical balance is allowing for the cells for the good, for the accurate communication. So it's going to prevent from free radical changes, from free radical damages, and also premature aging. Colloidal platinum also stabilizes peptides by enhancing its effectiveness. Yes, I'm going to send you all the materials, of course, Kathy. If I can ask you to send me, I'm going to write my email address. If you can, because when I finish the webinar, I can't see your questions anymore, so I want to be able to see your address. So I'm going to type my email, and if you can just send questions to my email. So it's sdermuk@gmail.com. And then I'm going to be able to give you all answers. I don't know why it works like that, but unfortunately, after we stop, I can't see any questions. Okay, so you've got all those active ingredients in the products. Also, what I told you about hyaluronic acid, we've got high weight hyaluronic acid, medium, low, and micronized hyaluronic acid. The molecule is between 5 and 10 kilodaltons, so it's so small that it's able to penetrate through the skin barrier without even compromising the skin barrier. So it's really moisturizing to the skin. Again, amino acids, glycine, proline, hydroxyproline. I'm not going to be telling you about those amino acids because I already told you about it. Another amino acid is leucine, very important if it comes to tissue reparations, slowing down all the protein decomposition and collagen and elastin decomposition. Leucine promotes regeneration process. Valine, again, hydrating actions to the skin. Arginin, lysine. Tocopherol, a very powerful antioxidant. Panthenol, precursor of moisturizing to the skin, anti-inflammatory, that's why it's so important to use it after microneedling as well, because it's going to subside inflammation. Vitamin C, vitamin B, which I told you about before, and argan oil, almond oil, shea butter, bisabolol. You don't have this lipolytic phase in the BioReHydra. That's why it's more appropriate for those oily skins. It's really wonderful for the summertime. I'm using it as a serum, and then, as I said, BioRelieved on top of that. Some more questions. Tocotrienol is better than tocopherol, isn't it? I'm not sure. I need to find out about that. Let me find out, and I'm going to get back to you. So these are active ingredients if it comes to BioRelieved. And I'm going to show you also some before and after. Do you have any questions so far about the procedures or about post-treatment care? I just wanted to share some before and after with you as well. So these are the before and after. Again, if you have questions, please type them up. These are free treatments. I don't know if you're following me on Instagram or Facebook, but I work with many salons, and they are wonderful. They always share their results with me, where you can see lots of different results. This week we had wonderful results if it comes to not hyper, but hypopigmentation, so those white patches on the skin, and absolutely wonderful results. So we combined BioRePeel FND with micropuncture method. So you can see them on my Facebook, on my Instagram. These are female, 35 years old, free treatments. So you've got really huge difference if it's in collagen synthesis. 4 treatments, 4 treatments, 3 treatments, 4 treatments again, 4 treatments. So you can have all the different skin conditions. 3 treatments, Just pay attention to the forehead. It's absolutely brilliant change. 4 treatments. 3. 4 treatments just with BioRePeel FND. Again, 4 treatments with BioRePeel FND. 4 treatments. Again, 4 treatments. 3. And this is body peel. 3 treatments on hands. And how I do the treatments, I start with face, then I do neck and décolleté, and always hands. Always remind your patients, your clients about the hands. Very often they forget about it. And when you tell them, oh, we can do a treatment on the hands without needles, because many of them don't like needles, they're like, oh, really? Is there such treatment? They always come back for, you know, the hands is one of the most popular treatments in London. 5 treatments. 4 treatments, really wonderful results if it comes to stretch marks. And melasma, BioRePeel body. And that's it. See some more questions. Instagram address. Okay, it's just Agnes Kuzniak. Quite simple, just Agnes Kuzniak on Instagram, and you can see all the results there. Also on the Facebook, so it's going to be Agnes Kuzniak on Facebook or Estam. If you have any questions at all, please don't hesitate to contact me. Or just type them up now, so we still have a couple of minutes so I can answer your questions. I'm hoping I'm recording this webinar, because sometimes I think I'm recording and I'm not, but I think I'm recording. So you'll be able to watch the webinar later on, or if you've got someone who would like to watch the webinar who didn't have a chance today, because I've heard that some people couldn't just log into the webinar, then it's going to be available on my Facebook for a couple of days. So if you don't have any questions, thank you very much for your time. Thank you very much for attending today's webinar. Again, if you need procedures, if you need any help, please do not hesitate to contact me. We always try to help you as soon as possible, and have a lovely day. Thank you very much for your time.